Okay, before I convert him, I want to show you a couple of things on the side here. There are links here on the side. Okay, these bring up some pretty cool tools that can help you in terms of your conversation with customers. For example, if I'm talking to a customer about the free pharmaceutical assistance program, the UNA card, I can look up their medication, put in their zip code, and I can get an idea of what the discount would be on their medication. Okay, the beauty of this is that this works for not just seniors, it works for everybody. All right, so let's say I'm granddad or grandmother, and I have a child or a grandchild living with me that needs medication. Okay, if we're not able to afford to get them insurance and we're struggling with the medication costs, I can use the free UNA card. I can look up that medication and get an idea of how much I can save that customer. The bottom line is, if I'm creating disposable income, it doesn't matter where it's coming from. It doesn't all have to come from me saving the senior money. Wherever they're spending it, whether they're spending it on themselves or spending it on someone else, it's going to be a value to them. You're bringing value to them by helping them save money. Okay, what else is there? Let's say this person sent in a lead card, but the phone number is a little obscured. If I click on this link, the system will automatically look up the lead. It's already pulling up that information. Of course, I would hope there's nobody named dummy lead, so it's not going to get a real match off of that lead. Now, this does cost money. There is a subscription cost. I think it's like $20 a month or something along those lines, and that allows you to be able to look up leads. This link takes you to our quoting tool. So you can quote Medicare supplements, final expense, hospital indemnity, dental, and Medicare Advantage all through this tool. Okay? Moving along. State programs. If I'm talking to a customer and I want to find out if there are any state programs available for them in their state. So I can go to Texas, search, and now I know that there's a program for kidney health care. There's a program for HIV, and these are state-level programs. Okay. A better example is if I look up Maryland as an example. Oops. Okay. Maryland has a Maryland Senior Prescription Drug Assistance Program. Okay. This program basically allows people that have lived in the state for at least 6 months who have incomes below 300%, at or below 300% of the federal poverty line. That means a senior can be making in excess of $30,000 a year and still qualify for this program. The program will pay $40 towards their Part D coverage, and it creates a special election so that they can enroll into a Medicare Advantage plan or a drug plan. Okay? So that's a great opportunity for Maryland. So you can look up different states. I know Maryland, Pennsylvania, New Jersey, Delaware have state pharmaceutical assistance programs that will create special elections. Okay, moving on. The next one is Cigna Resources. Okay, this will eventually bring up this page, which is the same place you go to do your Cigna modules. But if you log in, this, there's a ton of different resources. There's the resource library here. If you click that, if you want to look up, anything, you're trying to find Cigna resources. So let's say I want the provider directory. I can search here, and eventually it will bring it up. Okay, so here is the provider, Cigna HealthSpring provider lookup tool. Okay, and this eventually will bring that page up as well. Now, the good news is we have some other shortcuts. That gets you to the training and other modules. We have some other shortcuts that can get you there faster. Cigna plan lookups. If you click on this link, it will allow you to go and look up Cigna plans, but also from this page, if you want to find a doctor, you can use this, and this also allows you to get to the pharmacy lookup. So you can look for plans, doctors, and medicines all through one link. Okay. Next, hospital directory. This is another version of what we've already looked at. Same thing. In fact, I might even remove that because it's redundant. Okay, next, nearest hospital. Okay, now these are not just Cigna hospitals. Okay, this is basically going out and looking for the customer's address. In this instance, I didn't put a full address in there, so it's going from zip code, and it's going to eventually bring up a map that shows me all of the hospitals that are in the vicinity of that customer. Okay. Now the benefit here is if I'm talking to a customer about going to, Health South Hospital, which is 2 miles away, and they live right across the street from this hospital, the value of proximity is going to be a little bit lost on them when they can walk across the street to get here versus having to hop a bus to go here. All right. So this gives you some ideas, especially if you're selling over the phone and you're not familiar with the area. Benefits checkup. This is the big one. Okay. A lot of times you're going to talk to customers that are going to ask you to mail them something. This tool allows you to go through and do a full summary for this customer, and at the end of that process, it allows you to have a PDF that gives them state, federal, and private programs that can help reduce their prescription costs and perhaps help reduce their medical costs. Okay? Doesn't talk about anything about Medicare supplements or Medicare Advantage. These are just state, federal, and private programs that can help reduce their costs. Okay? All you do is go through and answer a few questions. At the end, it gives you the option to have a PDF that you can actually send to this customer. And then you can let them know, hey, there's more that's available. In that instance where you have someone that's insistent that you send them something. Okay? Next, send Medicare and U-Book. Okay? Now, at the time that I'm doing this recording, we're in the transition period from 2017 to 2018. So the actual physical books are not available to me mailed. The only option right now is to download the PDFs. However, once the books have been printed, you can go to this page and you can have a book mailed to the customer on the Medicare and U-Book mailed to the customer based on just going through here and filling out a form and requesting it be sent. It doesn't cost you anything. And that's another option available to you for that person that says, hey, can you send me something? Okay, I'll send you the Medicare and U-Book. You're not going to read it, but I can call you back in a couple of weeks and say, hey, did you get the book? Do you have any questions? They're going to say, yeah, no, I don't have any questions. Or, yes, I do have questions. Why did you send me this big book? Can you just tell me what's going on? Perfect. That's what I wanted to do 2 weeks ago. But anyhow, gives you a chance to move on.